nicotine is not even listed as a carcinogen, so it's not a matter of being a personal opinion. There has been some discussion about nicotine acting as a tumor promoter, which means that it doesn't cause the appearance of the tumors, but it just facilitates tumor progression. We haven't seen any real clinical evidence on that. And as I said, snus use, and with snus we have meta-analysis of evidence, so the highest level quality of evidence, epidemiological evidence, and we don't see any increase in cancer rates. So I think that this is not something of a debate. We know about that. Concerning cardiovascular disease, I know that there has been a lot of confusion because of the acute effects of nicotine. And we know that nicotine, when you obtain nicotine at the time that you're smoking or using other products, you have an elevation, an increase in blood pressure and heart rate. That means nothing in terms of the chronic long-term risk, because I will remind you that exercise results in an acute increase in heart rate and blood pressure. But exercise is a protective factor. It's not a risk factor for cardiovascular disease. I'm not suggesting that these products or nicotine itself is a protective factor for cardiovascular disease. I'm just saying that the acute effects of one behavior has no relevance and no prognostic value in terms of the long-term health effects. And that has been also displayed in the scientific literature with a study, I think, published in 2019, showing that people who quit smoking with electronic cigarettes had major and statistically significant improvement in arterial function within 4 weeks after quitting, and there was no difference in the improvement between those who quit with nicotine-containing cigarettes compared to those who quit with nicotine-free electronic cigarettes. And that shows that nicotine doesn't play a role in the improvement that you see by switching from smoking to other nicotine-containing products. So the evidence on nicotine and the harms caused by nicotine has been largely experimental and based on laboratory cell and animal studies, which have never been verified in humans. And I will repeat, snus research is a major source of information concerning the harms associated with nicotine. And let's not forget that snus is not a pure nicotine product. It is a tobacco product containing nicotine. And still, harms are minimal. I would avoid saying that it's completely harmless, but I would say that they are absolutely minimal, and there is no comparison with tobacco cigarettes.